Any changes to the lockdown measures in England should be made in a cautious but irreversible way, according to Boris Johnson. The Prime Minister hoping next Monday to set out his plans for easing restrictions, including target dates for reopening certain sectors. But he warned there was no cast-iron guarantee that the plans wouldn't have to change. While 15 million people have now received their first COVID vaccine, experts say that infection rates are still far too high. We'll have more on the vaccine programme in just a few minutes. But first, the latest on the restrictions from our political correspondent, Alex Forsyth.
It seems a while since school playgrounds were noisy, since these empty pubs were bustling. Next week, we'll find out when and how some of this might start to return. For so many families, it's been a long wait.
Missing work, missing just hugging people, really.
Oh, that side.
Driving instructor Harvey's business has been parked. His daughter Grace can't go to school, and they haven't seen parents and grandparents for months.
Really, it's been about a year since we've actually had them down here to stop, and nobody's getting any younger. So you just think, well, let's hope. But I just don't want to rush it and be back in this position again.
That's what he is trying to avoid, even with good vaccine news, urging caution.
We want this lockdown to be the last, and we want progress to be cautious, but also irreversible.
They're waiting for more data before decisions about opening up. Crucial is the effect of the vaccine on the virus and death rates.
I think the earliest indications would imply there's some effect, but I think it's too early to be able to put a number on that. Obviously, Israel is particularly far ahead in its vaccination programme, and there is some evidence of effects.
When things do begin to relax, schools will be the priority. It's hoped they'll start back in 3 weeks in England. More outdoor meetings could come next, followed by some shops opening, then possibly pubs and restaurants. But there's no fixed timetable or firm plan yet. Scotland and Northern Ireland are going at their own pace, and from Wales, a warning there can be no absolutes. Prime Minister, you say you want this to be the last lockdown, but can you really give that guarantee given the unpredictable nature of this pandemic?
No, I can't give that guarantee. Of course not. People should be very, very much encouraged by what's going on at the moment, but we want to set out a timetable that is realistic, and that means one that is obviously cautious.
All the time restrictions last, Labour says there must be support.
If we are to ease out of lockdown with caution, you need to put these other measures in place to stop the spread of the virus, like paying people sick pay, like ventilating buildings. I think if you do that, then this can be the final lockdown, and it has to be the final lockdown.
With the fast rollout of vaccines, there's pressure from some Tory MPs to ease restrictions quickly by May. But the Prime Minister's been accused of getting people's hopes up, over-promising then under-delivering at other points in this pandemic. Downing Street doesn't want to open up just to have to close down again. They know politically, and for the sake of public health and confidence, they have to get this right. For holiday and hospitality businesses, it means no certainty just yet. This caravan park in Cornwall has a backlog of bookings, but still isn't sure when people can come.
We are now fully booked for Easter, which is fantastic news, and that is 50 families desperate to come and have a holiday and have a respite.
We will know more about the possibilities next week, but for now nothing is set in stone, so much still up in the air. Well, the Prime Minister is expected to set out more details of his plan to ease restrictions next Monday, and it's thought that will include some dates which will mark the starting point at which various sectors might be able to begin opening up. But Downing Street's really keen to stress that nothing is definite, and it will all depend on the progress of the virus. They're going to keep a very close eye on the data. But while the Prime Minister was keen to stress a really cautious note, he did also point to the advances in science, of course the vaccine programme, but also treatments and testing, even suggesting that there could down the line be tests to get into nightclubs, quick turnaround, or for things like theatres. That's all a long way off, but it does point to the fact that even when things start to open, we could live with the effects of this virus for some time.
Alex, many thanks once again. Alex Forsyth with the latest at Westminster. Well, the United Kingdom has more than met the vaccine's target set 6 weeks ago. The Prime Minister said today that if supplies held up, vaccinations would be offered to everyone in the top 9 priority groups by the end of April, including those aged over 65 and younger people with underlying health conditions. But there is concern in some groups, people with asthma or those with learning difficulties, for example, that they weren't included in the first phase. Our health editor Hugh Pym has more details.
Thank you very much. Hi, good morning.
Visiting a vaccination centre today, the Prime Minister was keen to praise all those involved in getting more than 15 million people in the UK inoculated with a first dose.
If you look at what's happened in the last few weeks, it's been an unbelievable effort by the NHS and the doctors, the nurses, the GP surgeries, the hospitals. Of course, the army has been fantastic. The pharmacists have done a great job.
Warehouse workers and logistics experts helped get the vaccines to hospitals, doctors, surgeries and other hubs. This company's drivers covered more than 200,000 miles in 2 months, delivering more than 5 million vaccines in England. People aged 70 and over, NHS and care staff and residents, and those who are clinically extremely vulnerable were in the first target groups. On Friday, the Welsh Government was the first in the UK to report that everyone in the top 4 priority groups had been offered a first dose of the vaccine. Since then, ministers in England and Scotland have also confirmed that target has been hit. In Northern Ireland, officials say everyone in those groups will have been offered it by the end of this month. From today, the next priority groups will be offered vaccinations, starting with the 65 to 69 age range, nearly 3 million people. Then comes those under 65 with underlying health conditions, more than 7 million. Next will be the 60 to 64-year-olds, nearly 2 million. And then those in their 50s, more than 5 million, with a target of more than 17 million in the UK by the end of April. Some with asthma, like Ellie, who has to use her inhaler 4 times a day, didn't know whether they'd be considered part of the priority group with health conditions. She says the communication's been poor.
For me personally, it's just been the confusion over whether or not you qualify for the vaccine. It's been a pretty stressful couple of months.
Officials have said those with severe asthma will be offered jabs at this stage. Others, like Ellie, are deemed to be lower risk.
Come on, good boy.
Amanda, who has mild learning disabilities, said there was also confusion for her and others about getting the vaccine.
I was told I couldn't have it to begin with, and then I just kept ringing my GP and I still got nowhere. And this morning I phoned and they said that I could go to the local town hall and have it done.
All this means the latest phase could be more complex than before, with the added pressure of people from the first wave of vaccinations needing their second dose. Hugh Pym, BBC News.
It's time to have a look at the latest government figures, and there were 9,765 new infections recorded in the latest 24-hour period. An average of 12,580 new cases were recorded per day in the past week. 23,341 people are in hospital with COVID across the UK. In the last 24 hours, 230 deaths have been recorded. That's people who died within 28 days of a positive COVID test. 657 deaths were announced on average every day in the past week. And the total number of people who've died so far is 117,396. That brings us to the latest numbers on vaccinations. 237,962 people had a first dose of one of the 2 available COVID vaccines in the latest 24-hour period, which takes the number of people who have now had their first jab to 15,300,151. So now that I've gone through those figures, let's talk to our medical editor, Fergus Walsh. The Prime Minister said today that the number of infections was still far too high. Having said that, there are lots of positive signs in the figures.
Hugh, yet the daily cases are actually at their lowest level now since early October. On the flip side, there are still nearly 3,000 patients on ventilators and 1,600 people a day being admitted to hospital with COVID, and still more patients in hospital than at the peak last April. But this time round, of course, we have the vaccine and we have the first very tentative signs of the impact it may be having on reducing the risk of dying. Mortality rates among the over 80s are falling much faster than among younger age groups, and of course they were the first group to be immunised, but the data is still very early. We need 1 or 2 weeks more data to be sure about that. Now, Israel, which is further ahead in its immunisation rollout than even the UK, where they're using the Pfizer jab, have shown that 2 doses seems to prevent nearly all symptomatic infection and severe illness, which is really encouraging. But scientists advising the government would like to see a very cautious approach to lifting restrictions with a 3-week gap between each measure, like opening schools, because it will then allow them to ensure that the impact of that can be gauged, because what everybody wants is for this to be the last lockdown.
Indeed. Fergus, thanks very much again. Fergus Walsh there, our medical editor.